Welcome back. We have Dr. Michael Honig here with us, and we're going to talk about ACL. So I was just saying, you know, you never want to hear that you've torn your ACL. I mean, that's the worst. It's the worst news, and you're the one that has to give that news, huh?
I do, and I've had to give it on the field at football games and soccer games and in the training room. And you know, it's one of those things where you tell the young athlete, and their eyes just suddenly go downcast, and the parents are upset because they realize what a long road it's going to be for recovery.
So you said it's about a year recovery time, is that right?
It is. It takes a very long time. To get into some of the anatomy so that we understand what we're talking about, this is a model of the right knee. Sits like so.
Okay.
This is the femur up here, the tibia, the big bone, or the thigh bone.
To the next bone.
That's right. The tibia is this bone down here.
Yeah.
A couple of ligaments that help to stabilize it, but the ACL is this ligament right here in the middle of the knee.
Turn around to the camera and hold it real steady, and we'll get a close-up of that. I didn't know that existed in there.
So it's this little ligament right here, and it helps keep the tibia from going too far forward.
Yeah.
Does it just snap?
And it just snaps.
You can't just sew it back together and go on?
We've tried that many years ago when we realized it didn't work very well. It's sitting in knee joint fluid, and that joint fluid actually acts as an irritant and an acid, eats it, and so you can't sew it back together.
Sure.
So we have to reconstruct it, and that's where we either take part of the patella tendon or part of the hamstrings, these big tendons down here, have to drill holes in the bone to start out here and end up in the middle of the knee, another hole in the femur ending up out here. So very invasive surgery to reconstruct it. That reconstruction then takes a little bit of time to become normal tissue because you've taken it out of the body and then put it back in. And that's what takes about a year for the biology to really happen.
And you said men, women, you know, both susceptible to this, but women a little bit more so, huh?
Correct. Women have a 6 times greater chance of tearing the ACL, especially in sports like soccer and basketball.
So how do we prevent it? So we don't have to go through all this, right?
Sit in a chair.
Yeah.
Other than not moving.
Exactly, and that would be bad. So it's going to happen. If you're out there being active, unfortunately, it's going to happen, even someone who's just out playing around. But with certain programs where you just simply warm up in a little bit different fashion, and there's several out there on the internet. There's one very good program called the Santa Monica program, which there's a link to on our website. It is a 20-minute warm-up program that people can do 3 times a week, and it's been shown in multiple well-done scientific studies to cut down your chances of an ACL tear by 50 to 80%.
Well, let's remind everybody, you are Orthopedic Associates, you and 9 other doctors.
Yes, sir.
You're in Spartanburg, of course, just to bring that to our audience's attention. So I'm just not aware of this injury. I'm assuming football players and stuff go down with these things. Is that a primary candidate for it? Football
and soccer and basketball.
Really?
We had one season on a high school team where out of about 12 girls, 5 tore their ACL. Following that, we started instituting this rehab or the warm-up program that took 20 minutes. The next year, there were 0 ACL tears.
Wow.
So you can't prevent it, but you can significantly cut down the risk of it.
Sure, sure.
You can fix it then.
Oh, we can fix it. I'd rather prevent it than fix it. But I can fix it.
Well, we appreciate that. We appreciate prevention rather than fixing. But so we've got a website here, huh? OrthopedicAssociates.com. And that will that can give you some information, and all the information that you're talking about on prevention is available there too?
Yes, ma'am. And again, it's a very simple program. It's simply warming up in a little bit different way. It requires no extra equipment. It just needs a space to run and to do stretches and special jumps, because women do tend to land a little bit differently than men, and by doing these exercises they can learn to land better. And again, for 0 cost, for really 0 time commitment, because you're going to warm up anyway, you can cut down your chances of tearing your ACL by 80%.
Thank you.
Well, that is great news. Thank you so much for being here.
Yeah, they're in North Grove Medical Park, by the way, Orthopedic Associates.